Hello, welcome to our latest edition of Inside CRCAIH. I'm your host, Melissa Buffalo, and we are starting our 2017 CRCAIH Pilot Grant Seminar Series, and our first presenter is Dr. Mandy Fretts. So let me do a brief introduction, and then we'll ask her a few questions and have her tell us about herself. So welcome to South Dakota.
Thank you.
So Dr. Mandy Fretts is an assistant professor at the University of Washington in Seattle. She is most interested in observational interventional research aimed at improving the cardiometabolic health of American Indians. She has worked with the Strong Heart Study, a longitudinal study of cardiovascular disease and its risk factors in 13 American Indian communities for the past 11 years. To date, her research efforts have primarily focused on the association of physical activity, diet, a healthy lifestyle, or gene-diet interactions with diabetes-related phenotypes. She is interested in developing sustainable interventions to promote healthy lifestyle in American Indian communities for both diabetes prevention and diabetes management. So, Dr. Fretts, why don't you tell us a little bit about yourself and your background?
Thank you, and thanks for that kind introduction. So I'm an assistant professor at the University of Washington in Seattle, and I've been there for 12 years. I was a student for 6 years, a master's student and a doctoral student, and then I did a 3-year postdoctoral fellowship, and now I'm an assistant professor, and I've been in that position for about 4 years. My research interests include American Indian health, nutrition, and physical activity. And I also teach a class on epidemiology methods for master's students, which is it's an interesting class. It meets in the fall quarter. I might also pick up a class on nutrition since that's one of my other interests. Although I've been in Washington for 12 years, I'm originally from the East Coast. I am Mi'kmaq and a member of Eel Ground First Nation. My dad is Mi'kmaq and my mom is Lithuanian, actually. But I've been in Seattle for 12 full years, and before then I was all over the East Coast for college and before then. I'm the only one in my family who's on the West Coast, but I live in Seattle with my husband and my 6-month-old son and our dog. And aside from research and teaching on my spare time, I like cooking and knitting, although since my son was born I haven't had a lot of time to do those since he was only born in January.
Yes. Well, great. So again, 2 questions. So why did you choose this topic for your pilot grant research?
So I've always been interested in potentially modifiable risk factors for obesity, heart disease, and diabetes. And that's because those disorders affect my community and my family. And nutrition is something that I feel like people have the ability to change if given the proper resources. So when I was a student, I really wanted to study this topic, and I had the opportunity at the University of Washington to work with the Strong Heart Study. And that's a study of cardiometabolic diseases in American Indians who are between the ages of 14 and 93 years of age. And the study's been ongoing since 1988. So there's a lot of data in this area. So when I was a student and a postdoc, I primarily focused on the relationship of dietary factors and physical activity with the development of diabetes and other vascular diseases, heart disease, and healthy aging as well. And I feel like based on this work and the work of other Strong Heart Study investigators, we have a really good sense of what are the determinants of vascular disease and diabetes. We know that nutrition is important. We know that physical activity is important. We know that genetics is important. We know that blood pressure is important and cholesterol. But what we don't know is how best to change diet in communities and change physical activity. And it's not as easy as just having a physician tell a patient you need to eat healthier or you need to exercise.
Yes.
And there have been some small interventions in American Indian communities, and they've shown promising results. But I think the problem is that outside of these structured programs, it's really hard to maintain these changes.
Yes.
So this pilot grant gave me the opportunity to look at one specific Strong Heart Study community and assess the barriers and facilitators to healthy eating. And this information is really important to develop sustainable interventions that are community-based and that can be implemented using existing infrastructure. So hopefully they can promote sustainable change over time.
Yes, and I think we can both agree that we know diabetes affects American Indians at a very high rate.
Yes.
Like I'm sure we all have family members, so
of course,
it's impacted by. But
the burden of diabetes is
it's scary. So just one more question. What are the future directions for your research?
So the pilot grant gave me a really great background in the barriers and facilitators to healthy diet. We had focus groups with community members. We had key informant interviews with stakeholders in the community. We did a grocery store survey so we understand what foods are available in the community and how much the foods cost in the community. And we use this information to work with the grocery stores to test the feasibility of just how do we work with the grocery stores, who do we talk to, is the community accepting of this? And that was all part of this pilot program, or this pilot grant. And we have taken all of the findings from that and have written a larger grant, an R01 application, which we submitted to the National Institute of Health in October, and we're currently waiting to hear back. So we're hoping that it gets funded because we would like to continue this important work.
Fingers crossed.
Thank you.
Well, thank you for your time. Any last thoughts?
I appreciate the support of the Collaborative Research Center.
Yes. Well, thank you for your time, and we look forward to your presentation here shortly that we will be posting on our CRCA website. So, again, thank you, and we will see you on the next edition of Inside CRCA. Bye.
Thank you.